Welcome. This video is based on the cardinal rules of radiation protection. We have the three cardinal rules, which are time. In reference to time, we're talking about exposure time. Distance, the distance between the source of radiation to the patient and also the source of radiation to the radiographer. And also shielding. Shielding also refers to both the radiographer and also the patient. So when it comes to time, the dose rate to the patient is directly related to the dose rate and the duration of the exposure. Operator exposure comes from the scatter radiation, which is directly proportional to the patient's exposure. This also should be kept as low as possible. Distance. The intensity of the radiation changes inversely to the distance. It is obvious that the farther the person is away from the X-ray source, the less radiation dose per unit they will receive. Shielding. This refers to the different means of stopping the radiation from reaching your body. This can also refer to the patient, also as well as the X-ray tech. Shielding can have many different forms. You can be behind the behind the control room, the observation window, the operation station, or just the lead shielding on your person or on the patient. Okay, so shielding is basically the protective barrier that's protecting you, the radiographer, from scatter radiation, also the patient from direct radiation. Shielding is very important in pediatric patients because these patients are at very high risk for radiation because of their tissue is not developed yet. It can absorb the tissue and can cause many different forms of cancer. As far as to touch on time, this is also part of the ALARA principle. Always use as low as reasonably achievable. As far as with all these three rules, one of the most important one I would say would be shielding, because you have to shield yourself and the patient, and the lead has proven to be very protective to you and the patient. And when it comes to distance, you want to always be as far as possible, but most of the time they say 8 to 10 feet is enough as far as for distance from the radiation source. And as far as when it comes to exposure time, higher kVp, lower mass technique should be used to control this when it comes to the patients. Thank you for your time today.